Melanoma is considered the most serious form of skin cancer because of its high likelihood to spread. It develops in melanocytes, the skin cells that produce pigment or melanin. These cells are found in the skin's upper layer and are responsible for its color. When our skin is damaged by the sun, it triggers melanocytes to produce more melanin. That is why skin looks tanned after a day in the sun. That sun-kissed glow is actually skin damage. The Skin Cancer Foundation estimates that in 2021, 207,390 Americans will be diagnosed with melanoma, and 101,280 of those cases will be invasive, meaning that they have begun to spread. Melanoma is expected to cause 7,180 deaths in the United States in 2021. There are 4 types of melanoma. Superficial spreading. Melanoma is the most common form of melanoma and looks like an asymmetrical, discolored patch of skin with uneven borders. Lentigo, maligna develops most often in older individuals and looks like a slightly raised blotchy patch of blue-black skin. Acrolentiginous melanoma is the most common type of melanoma in people of color and commonly appears as a black or brown area under the nail or on the soles of the feet. Nodular melanoma is the most aggressive form of melanoma and usually presents as a black or blue bump on the skin. It can also be red or pink in color. While melanoma is more serious than other types of skin cancer, it is still treatable and curable when caught early. When it spreads into other tissues and areas of the body, it becomes more challenging to treat. Treatment options for melanoma include surgical removal, radiation, chemotherapy, immunotherapy, and targeted therapy. Early-stage melanomas that have not spread beyond the first layer of skin can usually be surgically removed, much like basal cell carcinomas and squamous cell carcinomas. Melanomas that have spread can be treated with immunotherapy, which are medications that stimulate the immune system to destroy cancer cells. This treatment option is usually more effective and results in fewer side effects than chemotherapy. Targeted therapies can use drugs to attack melanoma cells by acting on the genes themselves. Chemotherapy and radiation may also be used. The 5-year survival rate for Americans whose melanoma is caught early is 99%. The survival rate falls to 65% if the melanoma has already spread to the lymph nodes and 25% if it has reached other body organs. Interestingly, the survival rate for individuals who have a family history of melanoma is higher than people without a family history. This is believed to be due to the fact that those with a family history are more diligent about skin checks and seeing their dermatologists for any concerns, which helps them spot cancer earlier.